Brent Kell is the CEO of Valley Immediate Care, a leading urgent care provider in Southern Oregon. Since joining the company in 2002, he has expanded its reach from a single clinic to multiple locations, offering services such as urgent care, occupational health, dermatology, and orthopedics. Under his leadership, the organization has embraced future-forward initiatives, including mobile health services and a subscription-based urgent care plan. Welcome to DX the podcast, Brent.
Thanks, Dr. Giamalva.
Yes, it's so great to have you here. I just think about the work that you're doing, and something that really sets you apart is the way that you define the patient journey. So maybe differently than others in the market. Tell me a little bit more about your perspective on the patient journey, kind of that end-to-end, start-to-finish mindset when you're connecting with patients.
Yeah, I think a lot of operators look at urgent care visits as a single transaction, very transactional. We look at kind of treating patients more holistically. Patients coming in to see us, first of all, making the check-in easy, using Clockwise or an online check-in tool to make it really easy, minimize their time in the facility, which is a huge piece for most folks. Then beyond that, if they need testing, if they need imaging, we look at ourselves as kind of being their financial steward as well.
Love it.
So,
That's so great.
if they need a CT, trying to figure out where they can go with the least out-of-pocket expense, their convenience, we try to refer professionals to specialists. We know are, first of all, competent, but also have offices with the easy button to make it easy for our patients to appoint and reappoint as necessary. We then circle back with our patients at post-visit, check and see how they're doing. We used to be by phone call. Now we use text, which is a lot better.
So great.
But hey, how you doing? You can come back and see us if you need to. If you have any questions, you can call us. And we really focus on SMS communication as well. People very seldom pick up the phone now if it's on trusted numbers. So the text, I think we had 139,000 text conversations with our patients last year, and only 100,000 visits. So,
So all of that opportunity to connect.
Absolutely.
What I love about that conversation just now is every single aspect of it you are seeing as kind of like reflective on you, right? Even if you're referring to a specialist, sometimes the mindset is, oh, well, I've referred to them. It's their job now. It's their responsibility. But you have very specifically said these need to be great partners to us because it reflects on us, right?
Absolutely. In work comp, more in work comp than anything else. So work comp is if we're managing a patient, we're the attending physician or provider, who we send them to really influences the life of the claim. And when that claim goes longer than norm, employers know how long a low back strain or shoulder strain is going to take. If we're way outside the norms, because we referred to a physical therapist maybe is not aligned with return to work, more aligned with getting more visits, it reflects on us. So, and orthopedic surgeon, same thing if we're referring to orthopedics. So it's really important to us, for the patient, but also for the employer, for the adjuster, and work comp, it's super important.
Yeah, and you've done a lot of work with employers as well. Tell me about kind of some of those strategic, creative kind of aspects of how you've connected and made those connections in your communities.
Thank you. Employers are huge for us. And it's not just the obvious work comp, occupational health, drug screens, pre-employment physicals. We have about 2,500 employers that we work with on a regular basis, all the way from mom and pop to our municipalities where we do peace officer physicals and truck driver physicals. But those employers are also responsible for their employees' behavior outside of the work comp environment.
It's true.
HR, sends us tons of patients. Hey, do you think this is strep throat? Yes, that could be. And I go to Valley Immediate Care, come back with a note and say you're going to work. Do you think this is broken? Should I get an X-ray of this? So most of our larger employers actually refer a lot more non-work related things to us as well. The other aspect to working with employers is most employees, a lot of employees, not all, have private insurance. So your payer mix tends to be better with those patients as well.
So it's great on both ends. You've created a safe space that they trust. So not only the employers trust you, but now the employees have begun to trust you because you've been there for them during that patient journey. I know that there's some things that you also do to kind of connect them even after maybe a work comp situation that you're kind of mentioning to them, we're here for you still kind of thing. So tell me a little bit more about that connection.
Yeah, well, I think, employees come in and you take real good care of them. And even an adversarial, they've come in,
it can be
they
tough.
need a drug screen or something.
Yeah.
If you treat them with respect and you treat them kindly, boy, when they get a sore throat, they know where to come. When their kid maybe has a respiratory infection, they're going to come see you. So all those points of contact are really huge for us.
Yeah, so emphasizing that every single point of contact matters, right? Whether it's a text message or the front desk experience, the way that they register, how much time it takes to register. Yeah, every little aspect along the way.
And patients don't know necessarily how good we treat them clinically. They don't know whether we order the right med, we took the right x-ray. The x-ray was good or bad. They might know if we're a good phlebotomist if we miss a few times, but they don't know, but what they gauged their experience on their journey through your clinic, and that's either good or bad.
And that can be really hard for providers to conceptualize in their own brain, because we spend all these years training and learning, and we know without a shadow of a doubt we gave them the best possible clinical care and the choices we made were correct. But to your point, from the layperson, from the patient's point of view, they don't know anything about the medical textbooks.
Were they greeted?
Yeah, exactly.
Mm-hmm.
Exactly.
Did everybody smile?
Yes.
All those are what they gauge that.
Yes.
So I think as you said, each point of contact, from the time they first text us or called us, all the way they get that follow-up message, all the way till they get referred to orthopedics, and we get them back in a system. All those are huge. And the return to work piece for occupational health, I can't hit that hard enough, in that at 4 weeks, an injured worker is 50% likely return to that same job if they've been off work.
50%.
Keeping them in the system. It's like when you're a kid and you're off during the summers, and that September comes around and trying to get up and get dressed. And if you keep that employee in the system, getting up, making breakfast, taking a shower, cleaning themselves up, going to work, they're going to stay in the system. If you don't, it's huge ramifications for not only that employee, but their family and their family years down the road. So getting people focused back to work is absolutely huge.
Yeah, it's great. Tell me a little bit about the clinic tours that you do.
So we do all kinds of clinic tours with kids and adults.
Cool. I love it.
But what I've learned is employers like urgent care tours. And so I've used LinkedIn. I actually have my admin assistant kind of help with LinkedIn. We connect with local employers, and the message currently is, hey, glad to connect to you. One of the things I really missed during COVID was clinic tours. I love giving tours. If you ever want a tour of an urgent care clinic, message me.
Come on out.
And it's surprising how many people do that. And then you've got them for half hour, 45 minutes, and we do a sales pitch disguised as an urgent care tour. And we talk about all the things we just talked about. They have some return to work. And oh, by the way, we do pre-employment testing, and we've got drug screens, and we've got DOT physicals and audiograms and all the things we do. And at the end of those visits, usually people are saying, do we use you for occupational health?
Right.
I said, no, I don't think so. It's
like, I
don't know why we don't do that. So I said, well, can I have somebody contact you? We'd love to give you an idea. So almost each one of those visits, and we've done maybe as many as maybe more than 100 now.
Yeah.
Almost every single one is turned into us signing up and starting to do occupational health.
How cool.
Services.
Just kind of sparking that bit of curiosity, letting them see a little bit of the sausage making in the factory, and then also inviting them in to think about what could be our next step, which is really cool.
They really key also on some of our community events as well.
Oh,
Employers like people involved in the community. So the things we do with the high school kids and our bus build project and some of the things we do, they really key. And it's like, this is a really cool organization. They're very community involved. And so, why wouldn't I want to give my business to them?
Right. And it goes back to that trust factor, right? Like we talked about, if they're there for an employer reason or an injury, et cetera, and they felt like they were well cared for, they're going to come back. And if they feel like you're invested in their community and you care about them beyond just the walls of the clinic, that trust is going to grow deeper. So
it's absolutely true. And I would say 100% of the time. Yeah.
So 20 years or more in this space, if you could talk to your younger self, what is something you would have to say?
I would say enjoy the ride more.
Okay.
We're always focused on this next project, and it's enjoy the here and now.
Yeah.
I think as an organization, we talked about this a lot. We beat each other up internally. It's like, we didn't get this done, or we're not doing this, we're not doing a very good job over here. Yeah. But dang, we do a lot of stuff really cool. We need to celebrate that and not always wait for the next big thing.
So is there a special way that you and your team do those celebrations?
I think it's reminding each other.
Yeah. Just that constant reminder, that building each other up. Absolutely.
We do a really good job. And it's really, it hits home when you go seek healthcare at another organization, where it's like, wow. Yeah. My mother, a few years ago, had a lot of health issues before she passed. And boy, it's, it just reminded me that we do a really good job taking care of patients.
I love it, that you can reflect and see how the team is working together and caring for your community and all of the above. Great. Well, thank you so much for joining us.
Thanks very much.
It was awesome to hear about all the things that you're doing and just some little tidbits about where you're excelling, and just really appreciate you sharing your wisdom. So
thank you very much
for joining us, and we'll see you again soon.
All right.
Bye-bye. Thanks. DX the podcast was born out of the idea that we are ready to diagnose the future of urgent care with the smartest leaders in the industry. Find all the other episodes on Spotify and LinkedIn to keep up with us in this journey.